In today's episode, we're unraveling a story that challenges the very foundation of modern medicine. Over a century ago, a pivotal report forever changed how we approach health, sidelining natural therapies in favor of profit driven pharmaceuticals. What if one of those suppressed therapies could unlock remarkable healing potential that could reverse many of the chronic conditions so many suffer from? Our guest is an Emmy-nominated filmmaker that joins us to explore the often forgotten miracle molecule that delivers profound health benefits. This is the story of O3, the Ozone documentary with Luciano Blotta. Luciano, so nice to have you on.
Hello, Gasper. Very nice to be on. Thank you so much.
We
Grateful for
were
this
chatting a
opportunity.
bit before we got started, as one normally does, and we kind of got into our story. But I want to kind of understand. You've worked with some amazing filmmakers, Steven Spielberg. You've been in documentary, all these things, and Ozone is something that not many people know about, really. It may not be the sexiest of topics at times. It's a natural gas, right? What brought you to want to make a documentary about this miracle molecule?
Well, it's a fun story for me, at least, because it's I'm standing at the convergence point of two of my passions right now with this project, which
Mm,
is filmmaking and health. I've been a health nut all my life, which now we have a name for it, is biohacker, right?
right.
I think that's the word for it now.
Yeah.
Somebody who's like so into health that they go down these rabbit holes and you explore all healing modalities. And in my case, it wasn't because I was looking to heal something, but I was sort of wanting to know how to optimize health for, I guess, longevity. I'm a lover of life. I'm a passionate guy. Whatever I sort of put myself to, it is with a lot of passion. And now I'm doing this with the Ozone film because in this journey of discovering health modalities, I learned about ozone and instantly thought, how could this not be something that's real medicine and something that's being practiced all over the place as a normal thing? Such a simple thing too. That's
Yeah.
what blows my mind. And it's almost like a too good to be true kind of therapy from what I'm learning. And that's his weakness because people roll their eyes and say, what? It can heal your knee, but it can stop a virus. I mean, how is that related?
Yep.
So that's sort of the journey. And I sat down and I started writing after I worked on a Netflix show called Rotten, which
Mhm.
is a series about sort of food corruption in the food chain and in the food world. And I was so happy working on that film. I was one of the cinematographers. I shot two of the episodes. I said that's it. That day I said, that's it. I gotta write my health show here and bring and put the focus on these therapies that really nobody knows about. Because when I ask anybody, hey, ozone, even when I go to doctors, like
Yeah.
recently happened to me when I went to an orthodontist. I'm so excited because I'm in the middle of creating this project and I look at him. This was in Argentina, by the way.
Hmm.
I look at the guy and say, hey, you guys use ozone here, right? He's like, no, what's that? So, and
Right.
that is honestly, Casper, I asked 10 people, ozone, what is it? 10 don't know what it is.
Yeah.
And that blows my mind. So I feel it's like a crime. But basically, I started creating a show that's several episode show, episodic
Hmm.
documentary series that would put these therapies on the map in a very elegant and fascinating way because it is a movie that we're making after all. It's not some sort of medical dissertation. It's a movie, so it's about people and the journeys of the doctors and the patients and the biohackers using this to their benefit and the battles, the David and Goliath battles that doctors have to go through to make this happen. And it's just as far as the dramaturgy is great. So it's a
Yeah.
worthy subject and this is where I'm at.
Well, let's talk about Goliath for a second, because, in part of the trailer, you talk about the historical suppression that started about a century ago. And it started with a figure that most of us know the name of Rockefeller. Can you go into that and kind of what you learned happened 100 years ago that changed the game and changed the industry of medicine?
Definitely. That's such a huge point. I actually wanted to ask you what you know about it because
Oh, I've done my research.
at this point, I don't know a lot and almost voluntarily because I want to save it for when I start making the movie and get that fresh impression and start investigating. But basically, the Flexner report, as I understand it, was a document that was commissioned by the Rockefeller Foundation, 1909, early 1900s,
Yep.
that went and studied what was medicine at the time and like an evaluation of sorts. And they, I think, what I think arbitrarily discounted and erased from what is considered medicine a lot of practices and therapies and schools of medicine that were at the time, and completely sort of monopolized the medical system into, I think, two modalities, which is pharmaceutical prescriptions and surgical interventions.
Mhm.
And that to me is like, how come this is not known or explored or unpacked? So I want to really dive into that probably in the beginning of the film, because this is more than the story of a therapy. Like,
Right.
this is the story of how we got to this point where we're living in now, where it's a crime to mention something. You do a video and you mention certain words and you're persecuted for it. I'm like, how is that normal? Is that normal or okay? So really, it's a journey into exploring that. And like I always said, look, I identify with a peaceful warrior approach. I'm not a
Mhm.
political guy. I don't know. I don't want to confront the Goliaths, the biggest Goliaths. It's not my interest. Like, I do it by inspiring. So I want to make this in a beautiful way where people get inspired by what they see, and it's not really pointing fingers. That's not the agenda. It will be a little inevitable, but that's not the agenda. The agenda is to show what's out there and you
Yeah.
draw your own conclusions. So the Flexner report is something I want to explore, and I don't know much about at this point, but I will at the end. And I think there's a lovely surprise waiting for me there as far as dramaturgy goes.
Oh, yeah. Once you jump into that rabbit hole, it really opens your eyes as to why we are where we are in medicine. And I remember reading a book, and I tell people to read this. It's not the easiest book to read, but it's Rockefeller Medicine Men. And it talks all about what happened at that time. And the Reverend Frederick Gates. Now, it was a different Gates than Bill Gates at the time. Some people think they're related, and who knows, maybe they are. But he was basically commissioned by Rockefeller to change the medical industry, starting with schooling, starting with the universities. There used to be homeopathic universities were very big in the early 1900s, late 1800s. And he basically, through the vast amount of money that Rockefeller had, was able to start there and basically change the industry because, of course, so much of what we have now is petroleum-based pharmaceuticals. So they had to use the byproducts, and how can you make money? How can you control people through their health? And it really was just this systematic, in some ways, brilliant, you could say, very, very dark in other ways looking at it. But you look at that and you look at everything that changed, then you start to see we became a sicker and sicker society, but those types of companies became the Goliaths. They were nowhere. They weren't anything, at the beginning of the century. Now they are the controlling factor, right, of everything. So, it's one of those conspiracy theories, you could say, in air quotes, that once you look into, starts to really shape why we are where we are in healthcare and why so many are suffering, and why a lot of these natural therapies, such as ozone, are no longer talked about and basically, only whispered because the Goliath will come after you. In filming a lot of this documentary, when you're speaking to people that are voicing it, was there any concern that from people, from patients, from doctors, that hey, I'm a little hesitant to share this story because of Goliath?
Yeah. Look, not as much as I would have expected.
Hmm.
I guess the people who get sort of persecuted the most are the manufacturers of machines.
That's right.
They can have the FDA rate them, and it has happened. And I may have one of these people, probably with a blurred face and distorted voice or something
Yeah.
like that, anonymous,
Yeah.
tell the story because I think it's fascinating. People need to know this stuff. People,
Right.
like the world, needs to know this stuff. Not attacking anybody. I'm just showing you what's going on, right? And as far as patients, no, I was at a clinic yesterday filming here in Los Angeles, and
Was that with Dr. Ram?
yes,
I
Dr.
know Yoshi. Yeah, Yoshi was on this podcast. Good guy. I love Ebu and we use it here. And yeah,
I know,
what do
it's,
you have to
yeah.
say?
So he's, I'm sort of accessing people who are close to me at this point, because we're actually doing a global fundraiser to make the movie happen, which we can talk about in a minute.
For
But I
sure.
was there, and out of like just accidentally, but happy accident, is synchronicity. There was a lady there getting an Ibu treatment, and it turns out she was such a knowledgeable biohacker. I mean, out of control. Like the stuff that she's done for her health. And I sort of, we exchanged contacts, and I might have her in the movie because what I was hearing, it blew my mind. That she's doing every therapy to herself. She took lessons and how to do things, and it blew my mind. So not as much people are not as afraid as I would have expected, except the manufacturers. And doctors sometimes they don't want to again attack a lot, but rather
Yeah.
show. And look, another thing I learned, which is interesting to me, being exposed to the European system and the doctors from there at the conferences that I'm attending, they approach this a lot more cautiously and
Yeah.
very, very delicately, and they don't want to attack anybody, and they want to make it be medicine because it is. And actually, there's discrepancies in the dose, high dose, low dose.
Yes.
They're more cautious, and the Americans are a little more Wild West. But we're gonna
It's what
show
we do.
the whole spectrum,
Right, right. The Europeans are always of the kind of timid sort of like approach to it, not not making any wild claims to it, but just utilizing it and getting the results. Let's talk a little about the results and kind of what you came to see in building out this documentary and speaking to so many patients. Like you said, ozone's one of those things, like a lot, should be in medicine that can be used for multiple, different ailments. What are some of the ones that you saw that kind of stuck out and as far as what ozone can do?
Well, the original one that I was telling you off camera, but your dad saved a very dear person in my life, around more than 10 years ago.
Mhm.
And back then, I don't remember if I knew about ozone or not, but she said I had Lyme's, and that's the first time I heard this, and it blew my mind, like, what, the what? And it's this
Yeah.
weird thing that only this thing can sort of solve it, let's say. And
Yep.
it was ozone, and it was your dad that you mentioned. So your dad became an instant legend in my mind, and I said someday I want to put him in a movie, and that was the beginning of me learning about this. And from then, anywhere from any viral situation or skin, this is a personal favorite of mine, and
Yeah. Go.
it's an easy access point for people to get into ozone because you can do it at home, which is
Hmm.
ozonated oils.
Yes.
And people's minds are blown when I tell them, but they discovered that if you ozone is a gas, like you can't hold it anywhere. It's just very volatile and it just goes away, right? So,
Mhm.
but if you infuse it into oil, the oil, because of the viscosity, holds the ozone. So now you have portable ozone to put topically in your skin. I have to tell you, anybody out there listening to this, I say this is my line: never leave home without it. Like anywhere, I travel the world with a little jar of this thing, because anything that you have in the outside of your body, this thing is like it almost heals in real time. You can watch it heal if you stand there. Like
Yeah.
anything in your mouth or
The
gums.
big one, right? Yeah. Oil
Oh,
pulling with
I mean, just
ozonated
just the
oil.
other day,
Great.
just
Yeah.
the other day, a friend of mine shows up. She's like, "Oh, my tooth. it's hurting. I couldn't get an appointment to the dentist, and I think it's infected. I said, come here, get a little dab of the thing, rub this on. So the next day, I literally 24 hours or less, I get a voice message on WhatsApp screaming, saying, what do you give me? This is miraculous. I want to know everything about this. What is it? I mean, that's the most recent example I have. And then I use it all the time for any scrapes, cuts, anything you have on your skin. And so it's a really fun access point for people to start learning about it.
Yeah.
And it smells like, the only downside is that it smells like medicine. It smells like this very pungent
It has that
oxygen.
scent. Yeah, yeah. I mean, and that's the thing I think where people get it wrong because as we also stated, I think before we started recording, is that it is kind of like a noxious gas. You could say almost a toxic gas, right? If you were to inhale a lot of ozone, it wouldn't be, good. You cough and everything, but it has such antimicrobial properties. And it is natural, right? Ozone is that thing you may scent after like a lightning strike and other things like that. And so it's an O3 compound. Now, just looking at it, you probably dove into this in part of that, jumping down of the rabbit hole. But why does this O3 suddenly become such an important molecule in a lot of healing and therapeutic actions over O2? Can you kind of just break that down in what you know a little bit, layman terms?
Yeah, in layman terms, but I think I explained it well because I'm so passionate about it that I think
Right.
the passion does a lot of the heavy lifting here. But it's basically a signaling molecule.
Hmm.
So it's three atoms of oxygen. When it happens in the sky with the ozone layer,
Yeah.
there's a whole misconception there that we were going to demystify in the movie. What is this? What's the ozone layer? What does it have to do? So when oxygen in the air gets electrified, it separates, and then these atoms are floating around and they need to group, and they sometimes group into threes, and that's the O3. Now, this is the molecule of ozone, and it's a signal molecule when put into the body because it's sort of it's an oxidant, and we heard about antioxidants and how good they are most of the time, but an oxidant can trigger all these healing mechanisms in the body to start doing what it needs to do, let's say on steroids. So because it's such a molecule that the body sees as a hormetic
Hmm.
aggressor, I guess it's something that, oh, what is this thing coming in? Let's quench this. Let's send our best, juices and
Yeah.
and things that we have on board here to start healing. So it causes, reduction in inflammation and immunity, boosting immunity, and it neutralizes, because it's antibacterial, antiviral, it neutralizes any pathogen by a simple mechanism of oxidation. So, and it's really innocuous to the human being, except, and this is the whole misconception and the whole FDA hang up with this thing, is basically it's nonsense, because yes, ozone cannot be breathed. You can't breathe ozone because as I understand it, the lungs don't have the antioxidant capacity to buffer the oxidation. The rest of the body does. So that's why you can't breathe high concentrations of ozone. But
Hmm.
in the atmosphere it's present, but it's a low concentration, or it's up there. I really don't know yet the specifics, but there's
Yeah.
actually ozone generators for the home that blow ozone. And I am like, wait, I thought you couldn't breathe. Yeah, it's such a low dose that it doesn't do anything to you. But any pathogen, mold, anything in the house, it just zaps it out, neutralizes it. So
Hmm.
that's what it's doing. So it's such a simple thing. Like our doctor in the trailer that we
Hmm.
have a sample, it's a proof of concept 8-minute trailer you can go watch and see what this is about. And you'll see that you get the feeling, the idea behind this was to show what the movie would be like, and you see that it's not really a therapy. There's beautiful people there, you laugh, you get emotional, and a lot of things are going on because it has the potential to carry itself like that as a story, you know.
Yeah.
And yeah, so that's basically my take on that.
Yeah, no, and that's the thing. As much as it's it could be used in medicine, meaning you do major autohemotherapy where you're include ozone into the blood and bringing it back into the body for a systemic effect. You could do an ozone oil, right? And you could use it for so many other things. It's a disinfectant, so you could have an ozone generator that just disinfects. You could use it to help clean vegetables and
Oh, yeah.
produce, right? I've seen it
They have
used
a
that
laundry
way. It's a
machine.
natural way, no chemicals, no nothing.
Yeah, I've seen people with a laundry machine, and I'm really curious
Yeah,
about that one.
yeah,
Yeah, it makes so much sense. Like everything gets neutralized. I mean, ozone is used in water sanitation all over
that's
the
right.
world. I
Throughout
was
Europe,
listening.
right? I think St. Petersburg and Moscow are utilizing it with UV light instead of fluoride and chlorine, all these other chemicals.
Right. So and the beauty also in ozone seems to be that because it's a signaling molecule, sometimes you don't need a lot. It's not really like just do more is not better kind of thing.
Right.
And it is extremely powerful. So yeah, like everything else, you overdose on it, yeah, there's gonna be problems, but that's the case for everything in life, pretty much.
Yeah, yeah.
So it's it's an amazing thing. So I'm starting the project that is the episodic I told you about with the Ozone film as an independent endeavor, meaning I can always try to go to the movie business and say, hey, this is a show that I want to do, and see if some entity wants to get on board and finance it. But the moment they do, you start losing control, and the movie
Right.
is not what you expected anymore, and other people and ideas start to manipulate and influence and transform it into something else. So what happened here is I made this trailer and I presented it at an Ozone conference where the community just jumped out of their chairs and said, we want to make this, we want to finance, what do you need? And I said, wow, this is such a refreshing and unbelievable opportunity to make this the right way, because we will regain control, retain control, and no drama, unnecessary drama will be featured just for thrills, right? So that's what we're trying to do. And therefore, a fundraiser was born that is in effect right now. I think by the time this airs, it's still going on,
Hmm.
will still be going on. So we invite people to, if they believe in this cause, to jump on board and sort of pledge and donate whatever they can, because it's the number that we need to reach, but also the volume of people that come in create a snowball effect. So this is on the platform Kickstarter. The website
Hmm.
is o3movie.com. That's where you can learn everything about the project, watch the trailer, and then maybe visit the Kickstarter. So that's how it was born, and I felt such a good vibe. I just following energy,
Yeah.
and I'm very energy type guy, and it's so congruent and it's so harmonious that I sort of extracted that episode, so to speak, from the
Hmm.
show. The show it exists on paper right now, but that's what you use to sell a show. It's the paper,
Right.
project and a trailer. So I have those both things, but then these people were so into making this independently that I said that's a great idea, and that's where we are now, trying to make it happen that way, so that this can come out the way it needs to be, and then it will be on the platforms because I have distribution there. It will be on just most platforms, digital platforms, as a movie, and where people can go and watch it. So this is a big deal because a lot of this information, and one of my motivators here, it's because it gets presented either in an underground new agey way that instantly turns a lot of people off, or very conspiracy like
Hmm.
approach, which turns a lot of people off, or it's in podcasts, which are amazing, but you have to be looking for something and know what you want when you learn it through a podcast. So this is sort of try to bypassing all that and put it in front of people as a piece of entertainment or edutainment.
Yes.
So that they're in Amazon or wherever they are, and wow, what is this movie? The Miracle Molecule. Oh, let's check it out, and then hopefully keep their attention And look, we all know somebody who needs the help or is dealing with some health issue. If it's not us, it's somebody we love or somebody we know, or we want to know it for the future. So it's a valuable thing. And I think the world kind of, this story wants to tell itself. I think the world is ready to hear it. So I'm just a vessel, I'm a connector. I'm here to amplify the voices of those people out there that need their voices heard and get it to the people that need to hear it. So that's why I feel so congruent with this project. It's the combination of my two passions, and I couldn't be happier personally doing this. And it's very smooth, a smooth ride so far.
No,
Yeah.
it's a wonderful trailer, right? And I tell everyone go to o3movie.com, watch the trailer, give to that Kickstarter to get it independently funded. Is the idea, Luciano, then from that funding of it all to go through the distribution channels like Netflix, Amazon, and everything, and have it exposed to as many people to build awareness that way?
Oh yeah, absolutely. That's where it's going to live. I mean,
Yeah,
Netflix works a little differently because they either pay for something up front, but then they own it,
right.
then they tell you how to do it.
Yeah.
So we're not doing that, but I have with my distributor that has all my movies out and my projects guaranteed that they're gonna go on all the other platforms. I can name them if you want, but
No. I was just thinking because I remember I have a friend, Fraser Bailey, who made documentary Root Cause that went out on Netflix about root
my
canals.
friend too. We
Oh,
have
you
a,
know
yeah, I
Fraser.
was
Yeah,
gonna say I
yeah.
forgot to tell
Yeah,
you.
Fraser was instrumental. I met him all those years ago at a conference we were hosting, and he came. His girlfriend at the time was in the learning from us, and he came and we actually diagnosed his whole dental foci, and he went from there and started. So he was awesome. But then 2 weeks into it being on Netflix, the ADA, American Dental Association, attacked Netflix and basically said they can't be putting out this, and they cut it. Right. So I'd hate to see that happen to this because again, if it does what it's supposed to do, which is build awareness and educate, it also will upset those that don't want it there, the Rockefeller people that, are
Right.
doing this. And do you foresee that at all? I know things have changed even since Root Cause came out, and there's a lot of things that are out there that are, somewhat, on the edge and just may upset some people. But do you feel there's enough distribution channels that Goliath won't get its hand involved and find a way to,
Oh
censor
yeah.
this?
Oh yeah, those days are over, I think.
You think so?
First of all, shout out to Fraser because he's been like
He's
my
amazing. Yeah.
advisor.
Yeah. Fraser's the
So
best.
I hello to Fraser. He's been like involuntarily like my advisor on what not to
Amazing.
do just to not get banned. But
Yeah.
look, I think that film is a lot more incendiary, so to
It
speak,
may be. Yeah.
in terms of they really point to a problem,
Right.
and a lot of people can feel threatened. I think in the case of the Ozone movie, it's a little more spread out and diluted.
Hmm.
We're not attacking some specific entity or procedure or anything like that. Also, look, Netflix has that power because they licensed the film from Fraser and they decided to turn it off, and they can do that. But then you have the rest of the world and the platforms, and these days you can host your own thing and have it watched. So in any case, they cannot ban it from your own website, let's say.
No,
They
they
can
could
turn
try.
it off. They can start, attacking you personally, whatever. But
Yeah.
we'll see. I don't know. I don't even want to think about that part because
No, you got to think positive,
I,
right? I'm just bringing it up to play devil's advocate a little bit. I've spoken to Fraser since then too, and I think he probably advised you the same. Stick to focusing on the stories, right? The people, the results. Because he said himself, he understood that he was, kind of attacking in some ways involuntarily, not necessarily, with malice, doctors' whole way of making income through root canals and other things, then connecting it to possibly cancers and all of that could be seen as fear mongering and upset people. I think when you just stick to a natural compound in therapy like ozone, you tell the stories of people. It's not to say anything else is terrible and we need to go after them or anything. It's just to say, hey, here's an option you may want to look into.
right, exactly.
Yeah.
Exactly. So that's my hope, and the mission and the road that I'm traveling is sort of there. And it's tempting when you're in the editing room and you're building the movie, because movies get really built in the editing room
Yeah.
afterwards. And it's tempting, you have opportunities to make it, bring up the spice, so to speak,
Right.
or dial it down. And
People love
that's,
controversy.
I guess, I have that responsibility to make it a little bit of everything. Now I know that I won't be able to please everybody 100%. There's a lot of people involved here. Everybody's jumping on board. The support is incredible all over the world. Doctors, clinics are donating. Everybody's like, it's unbelievable. It's beautiful. Now, that's, people have different opinions, and like I was saying earlier, the Europeans with a low dose, the Americans with a high dose.
Yeah.
I can tell you one thing. I know I won't be able to please everybody 100%. Like any movie, two people go watch the same movie. Somebody's like, it's okay. Oh, I loved it. Yeah, that's
Right.
fantastic. So that's going on, of course, because it's a movie.
Yeah.
But I can tell you that I think everybody involved will be proud, and to have this and to have been a part of it and help make it happen, that I can pretty much guarantee. Because yeah, you can see from the trailer what the mission is. And
Yeah, yeah, no, I think it would be an amazing educational kind of, documentary and really showcase the benefits of this. Is the idea, Luciano, also to then continue onto other, types of therapies and other things that may educate people as to, oh, there's more than just ozone in conventional medicine.
great point. Yes, absolutely. Yes.
Yeah.
Now, that's a Goliath for me to tackle. The show that I actually created, it's already created, it's on paper. So I'll tell you a bit about it. But like I said, because I felt so much love from the ozone world, I extracted that episode and we're making it as a standalone film to then serve as a proof of concept or pilot, like
Yeah.
it used to be called, for the rest of the series. It gives us a lot of power and more strength to come into the film world and say, hey, look, already have the first film, people love it, help us get the other stuff done, and so that we don't have to do it with a fundraiser, because it's a lot of work. The
I
fundraiser,
know.
it may or may not work, I don't know, but some way or another we'll get this movie done. And I decided to start there. The next one that I have planned, which is another therapy that I'm absolutely fascinated by, and I think it's another crime that it's not used, is chelation. And
Mm,
everything relating to how to get these heavy metals out of your body needs to be addressed. I cannot understand how this is not a part of medicine.
right.
The elephant in the room, and nobody knows about it. Like, and
Yeah.
especially that there's a way to do it. And again, this story has a lot of dramaturgy in it as well. It's my yeah. I would jump onto this one right away. If once this is successful, that would be the next one, because there was a trial, the TAC trial. I don't. Are you familiar with it?
Heard of it.
There
Yeah.
were two of them, and the first one was so successful accidentally because they actually did the trial to prove that this is quackery. That was the mission of the trial. That's why the doctor in Miami, got the money to do it. I'm friends with him, and we're talking, and because I want to tell the story, and then the trial was so successful that apparently medicine nothing like this has ever seen, and in an area that was completely unexpected, which was saving gangrene feet from amputation, from diabetics. It had a profound impact there. And they were like, no, this is not enough proof. You got to do another trial. Now, that's another 10 years of
Yeah.
somebody's life
Yeah.
that blinded, doesn't know what's going on. And this just concluded a few months ago. And I actually tried to be there with the camera because it coincided with me already beginning to pre-produce this project, I said, this is incredible. The timing is perfect. I want to be there when they open that folder up and reveal the results.
Right.
With the help of this cardiologist in Miami, we wrote letters and tried to do the whole thing, but I was denied.
Ooh.
And otherwise we would have the footage of the moment. So now I actually don't really know what happened with this trial. I think there's some conflicting things I've been reading that feel suspicious to me, because the other trial was like over 56% successful and this one is not. How? Like,
yeah.
So
yeah, that's the tough part of the politics in, these sort of elements of study, trials, and research, right? That there's money involved, and when there's money, there's motivation on either side by many different people, and that's the unfortunate thing. It's the reason I like to say evidence is wonderful, but I think experience is something that you can't really buy. Right? Evidence can still be somewhat subjected to influences, but your experience is something else, and that's what I think you're able to do in this documentary with Ozone, is show the experiences of so many and show those positive results and what those people are actually saying. The evidence may, be deciphered differently, or we need more, more studies, more this, more that, but the experience you can't really go against because it's someone just telling you precisely their truth.
Well, that's been in my life personally. I know it's a little innocent to say it, but if I see something work, I mean, why is that not evidence? For example, like I say, with the oils, I put this on my skin and just try it for yourself. Like, what else do we need to know about this? Like, look at the thing. It's immediate, and it's not some gnarly cream with all these chemicals in it. It's like the most simple. It's actually olive oil that they put it on.
That's right.
And oxygen. And voila. And like, I don't need more evidence. Do I need a $20 billion trial in 10 years to show that this cream is good for the infection on the skin?
I know. I think part of the problem, Luciano, is people are drawn to new and, flashy and complicated things, right? That they don't even understand. Chemical names they could never pronounce themselves, but, clinically shown to do this and that. But, if that were the case, if all the research we've had in so many decades for things like cancer and everything, then why aren't we healthier, right? If the evidence really took us to a better outcome, then we would be a healthier society, because there is trillions of dollars being poured into these types of trials, research, studies. The war on cancer has been going on for decades. So much money has been poured into it. We have more cancer than ever, right? So, that to me is where I start to say, I know that evidence is very necessary, especially in a field like medicine. But at the end of the day, what is your experience? Did you get better with a more natural, simplified approach or not?
Yes, I agree. It's sad. You see, it's impossible not to get into the conspiracy side of things.
It is. It's very difficult not to even use that word.
Well, what would you say to this? Because sometimes, I guess in my personal circle, I'm telling them what I'm doing, and of course they don't know what it is. Everybody, like I said earlier, and they're like, those who want to play devil's advocate. Oh wait, look, I don't think big pharma loves money. So if this is good, why wouldn't they want their hands on it? And what do you say to that?
Oh, it can't be patented, number one.
But still, I mean, doctors are profiting from it. Actually, also
are they to the amount that big pharma and shareholders enjoy? No. You think about drugs, you think about the ROI. I've seen what the ROI is, in the thousands of percent sometimes on all of these. It's the reason Bill Gates has made so many millions and millions of dollars off of investing in things like vaccines and healthcare. It's incredibly profitable. It really is. And as soon as you drop the patent, let's say, we know this from things like ivermectin and others that have dropped that are Nobel Prize winning drugs, it just doesn't have the same appeal to these companies. And again, I have a background in business and finance. I've worked in the Wall Street area and everything. And you have a fiduciary duty to make as much money as possible for your shareholders, and everyone wants more, right? So if you said, all right, we have something that number one can really help a patient quickly, isn't that expensive because, ozone relative, to a lifetime of drugs is rather inexpensive and will help prevent disease in the future. Those three things are like less profit, less profit, less profit, basically.
Is the no-no. Yeah, because it
It's a
actually
huge
helps.
no-no in
In fact,
business.
doctors have told me shocking things. I want to really unpack it and get to the truth of it, but they say, hey, if ozone was put on the map, it would decimate, it would bring the
Yeah.
pharma profit to down to 30% from 100. Like,
I would say 80% of that revenue and profits would go down. They'd still be incredibly profitable, but they wouldn't be the Goliaths anymore with the billions and billions, right? They would be a normal company, a large company that makes hundreds of millions, let's say.
I think also, given that it's really the simplest thing, it's very cheap because it's just an oxygen
There, right? Yeah.
machine. Right? I understand why the price is what it is now, but in the future, to me, I see it as it's like somebody putting a band-aid when you're any clinic, any doctor office. Oh, here, let me put a band-aid on that for now. Like
Yeah.
meaning so accessible that it's like it's there on the shelf and you do it and it's not an expensive thing.
Right.
It heals. So maybe it was a bad analogy because band-aid is
I know it's
the
the,
term
the
used to
analogy
say
you
something
usually
that is
associate with
that's
conventional
what pharma
medicine.
does.
Let's put a band-aid on it, but it's the healing process of what happens
A
under the
gauze, I don't
band-aid.
know, something that's just on the shelf there. It's such a simple, cheap thing that you don't even. It's so accessible because I see it as such. I mean, the other thing that you can do, and I don't know, you can tell me what you think about this one, but
Yeah.
I don't know if to really show this on the movie or not yet. But how this is something you can access at home
Yeah.
because if you're a biohacker and so inclined, you can have your own small little machine. It's not terribly expensive for what you can get out of it for a lifetime of treatments at home. And there's other ways of administering it at home that are not so glorified. But
Rectal insufflation, I believe, is the term you're looking at.
in the, you can put ozone in many orifices of the body,
Yes. Yes.
except your nose. Don't put it in your nose.
Not to breathe. Yeah.
Or you can drink ozonated water
That's right.
or even as a mouthwash. Have you
Yeah.
ever tried? I mean, forget mouthwash. This thing, it's ozonated water. It's like the best mouthwash in the universe.
And again, I recently posted on this, like Listerine, Cool Mint Listerine is actually now linked to increased numbers of oral cancers because you're killing it's an antiseptic. You have an oral microbiome that is necessary, good, bacteria in your mouth. You get rid of that, and it's actually increasing the number of cancer when so many people, again, I'm pretty sure the 10 out of 10 people that don't know ozone would say there's nothing that could be bad about Listerine. It's been around forever. It's great. When you're right, something like ozone is way more beneficial to rinse with. Just ozonated water would be so much more beneficial. But again, if the awareness isn't there, then you can't do much with that because the information isn't in the head. And then I think also one of the things I'd love to hear your take on this because there is a belief system, right? There is a belief systems in people's minds still that, healthcare, medicine, FDA, government, they can't be all like, against it. And if they're not talking about this, then it can't be really something that is so, significant to our health. So, part of it is also, Luciana, I think education is great, but how do we then change the belief system that takes time to unravel and basically everything you've been taught deprogram?
I think it goes back to the Flexner report
Yeah,
because it all stems from there because it has to start in school where the doctors are being trained.
that's right.
Because people are listening to the doctors up until now. I guess we're in an era of communication now where this is changing,
Yeah,
but it all stems as a residual thing from that, where you listen to the doctor. If he's not talking about it, then it's quackery.
Yeah.
and this has been perpetrated and it's floating out there. I ask, like I told you, I go to a dentist, I turn around, hey, you guys use ozone here, right? Because ozone in dentistry is such
Huge.
a no-brainer.
Yeah.
It's
Yeah.
such a
It's
no-brainer because it's
probably the
topical,
easiest way to start with
easiest way.
something is
Try
dental.
it for yourself, like I did with my friend, put it on your
Yep.
infected tooth or your inflamed gum, and call me the next day. Literally, I'll be waiting. It's
Yeah.
illegal. So in dentistry, it's such a no-brainer. And the other nice aspect that I want to explore in the film is how it's being used in veterinarian use.
Mm,
Because, and this is the important point, animals don't have placebo effect.
this is right.
So explain this to me now. How, and you look at the testimonials, how anything, let's not even mention anything on the skin, that animals get a lot of problems, in their skin
Sure.
and the fur. Gone. I did that with my mom's cat one day. She called me the same, it's a pattern. The
Yes.
next day she calls me. She says, this thing is amazing. I could see the ear, she had a bite in the ear or something.
Mhm.
The cat, I could see it heal because it's done, it's healed. Yeah, I know. Like I know. I roll my eyes. I'm like, oh, so this is like I know what I'm gonna hear the next day.
Yeah.
So
I've I-
that's
I've heard people say that both animals and children are the best patients because they don't have those preconceived notions of whether something is going to work or not. They just accept it as is, right? Because they don't know what's happening in a sense. And that's why so-called alternative therapies work so well. You have horses that heal so quickly with PEMF, with ozone, with all these things that are alternative, but the veterinarians are using it, seeing great results. And that also goes back to placebo, effect is really just your belief system in something.
right, which is definitely a thing.
Oh,
If,
huge.
if it's a thing that you can use in your favor,
Yes.
but just to prove to, I guess, deniers, the animal aspect is a great one to show,
Yeah.
because I've seen things in the photos I've seen in the conferences and such, where here's the distinction. Like it's not like they put ozone and it healed, and how do you know it worked or how fast? No. These were animals that were put on traditional
Right.
medical treatments and nothing wasn't working. It wasn't working. Weeks or months on antibiotics, nothing's going on. They do ozone a few times and it's done, resolved.
Yeah.
So that's the main point. I saw a horse that had its entire back like open. It felt like a butterfly steak. I had never seen anything more shocking in my life. I'm like, how is
Hmm.
this horse even standing? They bag the horse with the bag and ozone bagging. So you cover the skin with a bag and you send ozonated gas there, and slow. The only thing they did slowly, that wound. I'm back to almost no stitches, nothing. I mean, you couldn't even stitch it. It was a foot
Right.
wide, like.
Wow.
So this is mind blowing,
It
and
really is.
deserves to be documented. There's another aspect that's it's kind of like a hush hush thing, which this is very fabulous for athletic performance and
Yeah.
athletic enhancement. And I don't know really if it's considered doping or is it for sport, competitive sports? I don't think it is, especially if you're not doing anything with the blood. So
Yeah.
it's being used all over the place. And for any traumatic injury, that's the thing. When they discover prolozone, which is the injection directly onto a joint of the ozone gas, which works locally instead of systemically, like the blood treatment. You see it in the trailer.
Yeah.
That trailer was filmed. I was at that clinic for 1 day and a half.
Hmm.
And I was exposed to the patients that were there that day. It's not even a premeditated thing that I looked for the world for the most impressive treatments, sort of patients' testimonials.
Yeah.
This was just what I found that day. Maybe when I went there, if there wasn't anybody there, then the trailer wouldn't have those testimonials. It's just they were there.
Right.
And all of them are incredible. Like
Yeah.
some guy that doesn't know why, he doesn't want to know. He's like, dude, they gave me They gave me this injection in my back. I threw it out in the gym. I walked out of here done. Then the old lady is really funny that she's been using it for her vision and does nothing else,
Hmm.
and she's 91.
Hmm.
And the lady with the arthritis in the hands, and this is something you can see, you can visually see it. And she told me she couldn't even put the zipper up in her pants because it hurt so much, that just that movement. And that how ozone first treatment, she's like, what is this? I feel it already. Like it's
Yeah.
bringing down the inflammation. And the lab work shows that the proof is in the pudding. Like the lab work shows with numbers. So it's what else that's our need. What else do we
Right.
need to prove it, right?
And if nothing else, I would hope that people, by bringing their awareness to it, would at least say, why wouldn't I try this first before I go to something that has side effects or that may require surgical intervention that is quite invasive with a lot of possible complications? I've always thought that, it's one thing to be even skeptical, but why wouldn't you try something and work your way up to the most kind of side effect or most kind of invasive type of approach and not start there and then work backwards and then finally end up, with, oh, all right, I'll try ozone after doing all the drugs that, have had so many side effects, surgery that didn't take, and now I have surgical scars and all these other things. Why won't we start there? And I'm hoping this is what we're able to find out, is that people's awareness will say, well, why don't I try it before I go to the drugs for life?
Right. There's a place for everything. I mean, modern medicine, it's science fiction. It's incredible what it can do.
Sure.
It's more designed to save you from drastic situations. But this is actual health and health prevention, which is a different story.
Yeah.
Look, it takes two to tango. This is, I always say this because there's a tendency to blame the system and blame the doctors, and yeah, that's very tempting. And it feels like you're in with a cool crowd when you say that. But it takes two to tango. Also, people, I think we're entering the era where you have to, it's in your best interest to become a biohacker, so to
Yes.
speak, and sort of take a little bit of more control and decide. And from the menu of options that are out there, I don't see a world where the paternalistic, doctor
Hmm.
patient relationship is definitely been broken. And maybe the old timers are still, I understand how this is a weird concept, but with the amount of information that exists today, and most people who are healing traumatic things and situations, they had to become biohackers
Yeah.
and look for themselves and try things and put a lot of effort and become the CEO of your health. This is, I
Most of the
think,
time it's out of that necessity, right? If you're sick and you're running out of options, it's necessary to look outside that and be your own best advocate.
yeah. So it takes two to tango. You can blame them all you want, but if you're not, if you just want the pill and the quick fix, then it's on you too. So
Right.
that's why I think ozone is a beautiful biohacking modality, and to use that word, but like a healing modality that you can access yourself at home if you want to, if you're so
Right.
inclined and you're adventurous enough with the right, coaching and knowledge how to do it. Otherwise, go to a clinic and you get it done there. And like you said, then you can escalate from there. And the other thing is, it's also a very good adjunct to any other therapy. It makes them better. It makes everything better.
Hugely.
Take
Yeah.
antibiotics, you do ozone, it's like, wow. For any, that's what I'm learning. And it's a
Hmm.
great palliative for people who are in terminal situations. It just makes things better. So,
Yeah.
like the doctor says in the movie, in the trailer, I'm not gonna sit here and say ozone cures anything.
Hmm.
Let's start there. It's not the ozone. It's your body being awakened to do the right thing. And yeah, ozone directly has an oxidative thing onto pathogens, but the rest is your body doing the right thing and being instructed by the ozone signal to do the right things.
It's simply a natural catalyst to your self-healing mechanisms. And that's what else could you want in healing is just something to awaken what you already have inside of you to make you the healthiest version of you. So,
It
you know,
is.
I always said it's something everyone should look at, and I really do hope this documentary allows people to at least become aware of it and start to see how powerful this could be. Luciano, where can people go again to learn more to give to the Kickstarter fund?
So you can either go to kickstarter.com, that's where we're hosting the fundraiser, and then just search in the bar O3 movie. Just plugging in O3 will take you to the campaign. Otherwise, you go to the official website, which is o3movie.com, and there you'll see the link to Kickstarter, but you learn about the movie, you can watch the trailer. And the Kickstarter is live until December 22nd. That's when it closes, and that's when we need to reach the goal by December 22nd, 2024. So yes, I invite you to be a part. If you believe in this cause, in this message, I always ask people who know me, don't do it for me just because you know me. Watch the thing, and if you're moved by the message, then take action. You're not doing it for me. This is for the world. People who are donating, I want them to understand that it's not for me. It's bigger than me. It's bigger than all of us. You're really helping the world gets this. So that's why it's a collaborative thing, and there's a pride in that. Say, hey, I was a part of bringing this to the world. That's what this is about.
Mm-hmm.
No, give money to this guy so he can make a movie. No. I'm putting my grain of sand so we can have this exist. It's like a magic wand, because if everyone does it without questioning, thinking too much about it, it doesn't matter the amount, because if everyone does it, could be $5, we get the movie done. It's a magic wand. You touch, a movie appears on the other end.
Yeah.
That's what it is, because I'm there in the middle making it happen, and it will go out. So
well, it's entertainment that heals us, that helps us. So that's the best kind of entertainment. So I'm really hoping that everyone can go there and donate to that and make this a reality, because it's really important. And I want to thank you for being such a pivotal part in bringing this to the world, because we need some healing in this world, and we need to know of the options out there that will preserve our greatest wealth and health. So thank you so much for that.
Thank you for the time. And by the way, please keep an eye out for patients at Innovative. If something comes to mind that needs to be documented, we're looking out for this type of stories. So
yeah, well, we got plenty. So let's talk about that. Let's talk about that some more and showcase some more of these things. I'm sure you got a lot of other documentaries, you could be doing about this. So, Luciano, thank you so much.
Thank you, Casper. Real pleasure being here.
Yeah, be sure to go to o3movie.com. Give to that Kickstarter. You have until December 22nd. Let's make this a reality. And until next time, keep writing your own healing story.